Healthcare is about taking care of people, and that's difficult to achieve without a strong and healthy workforce. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Petterly with AHA Communications. Delivering high-quality, compassionate care to the communities we serve remains the top priority of the AHA and our members, and our ability to provide that care depends on a strong, well-supported workforce. To that end, we must address the root causes of emerging and continuing workforce issues, then implement thoughtful and sustainable solutions for improvement. Join us to hear valuable insights and real-world approaches outlined in the 2024 AHA Healthcare Workforce Scan to help organizations reimagine, redesign, and transform workforce strategies to support, retain, and recruit staff.
Thanks, Tom. I'm Elisa Ares-Pagochaga, Vice President of Clinical Affairs and Workforce with the American Hospital Association. Joining me again this year to share their insights on workforce trends are Ron Werft, President and Chief Executive Officer of Cottage Health, who chaired the AHA's Board Task Force on Workforce, and Felicia Sadler, Vice President of Quality with Relias. Welcome to you both, and thank you again for joining me.
Happy to be here. Thank you.
Thank you.
So we're here to talk about workforce, and in particular, the AHA's 2024 Healthcare Workforce Scan, which focuses on three critical workforce challenges confronting hospitals and health systems. First, providing high-quality care with a changing clinical workforce, sort of shifting faster and further than we ever have before. Second, building a sustainable and adaptable talent pipeline. And three, what I often refer to as the table stakes work, which is supporting the well-being, satisfaction, and safety of the team that comes to work every day. So, Ron, I'm going to start with you. How are you seeing your colleagues and how are you tackling some of these challenges and maintaining the effort and the dedication to continue to do this work and address these foundational challenges?
I think that we've certainly seen some improvement across the industry, really. Employment's back to levels of pre-pandemic, and of course the demand for patient care is back where it was before as well. Contract labor is down, the amount that we're paying for contract labor is down. We're seeing some reductions in turnover in various regions in the country as well. So there are some reasons to be hopeful. I would just say that it's really important that we keep our eye on this one, because as we know, it is top of the list of CEO concerns across the country. And I think it's the sort of thing that is, if you see some incremental improvement, you might think that you can move on to other things, but that isn't the case. And certainly the colleagues that I have the good fortune to interact with, they're continuing to take it very, very seriously in both, not so much a crisis anymore, but seeing it as a mid and a long-term challenge that is really important for us to address.
Absolutely. And I know we've, throughout the task force work, we spent a lot of time thinking about both the upcoming challenge of increased patient care, smaller numbers of providers, and how we sort of manage for that. So I think we've sort of defined this as a math problem going forward. So Felicia, would love to hear your thoughts on what you're seeing around the field as well.
I couldn't agree with Ron more. We think about the crisis that we just went through, the pandemic, unprecedented times. It certainly disrupted so many things. As we think about what organizations really need to do and what we've seen them doing around reimagining, redesigning, and really leading transformation within their systems, it becomes critical. And as we think about high reliability focused organizations, sustainability is also a big factor and something that's vital. We get to that moment, we think, okay, we're past the crisis, the numbers are looking better. What can we move on to next? And workforce has always been something that has been a challenge as we think about healthcare, but even more so now when we think about the shortage that we've just encountered, and certainly in certain parts of the region they're still encountering. So commitment to sustainability, high reliability, understanding what's working, what's lessons learned, what hasn't worked well, and moving forward with a strategic plan and focus long term.
I'll just add, if I may, that I think that the workforce or HR section of our strategic plans, if it even was in there, was not front and center. And so I know we've just gone through the next iteration of a formal strategic planning process. Our board approved a workforce development plan that's 5 years long, and it's actually patterned after the work that the American Hospital Association did. But it's no longer just a way to get our mission accomplished and to get the daily needs met. It's really part of our strategic thinking now. Just important that we see it in that context.
And I think that really feeds into my next question, which is that I think we're no longer looking at pretty much anything since the pandemic in the same way that we did before. So we're thinking about redesigning care delivery, thinking about different staffing models. We're trying to build the plane as we're flying it. And, while it's already trying to do a couple of loop de loops on the way, I mean, we're really trying to think through with maybe in some cases a smaller staff, how do we do this differently? And how do we bring technology into that? So I think there's, Ron, I'd love to hear sort of your thoughts about how you're keeping your eye on all sort of three of those, that the idea of the workforce, what technology you might bring in, and then how you manage all of this in the current financial environment.
Just before talking about some of the things that we're seeing here in our region, I'll just speak to the fact that nationally, organizations are in very different places depending on their size, their scope, their balance sheets, as to what extent they can actually invest in technology and take some risks in new care delivery models. And so I just want to make that point that going to some national meetings, you might be sitting next to somebody who has an innovation center and is able to invest a lot into new models. You might also be sitting next to somebody on the other side who's still really struggling to make sure that their ER is staffed today. So I think it's important, and this is one of the things that AHA is so very good at, is creating resources that meet each of us, where we are, and just really express my appreciation to the AHA for offering something for small rural hospitals, for large urban centers, for multi-hospital systems, and small systems like ours. What we're seeing, I think, is well known to really all of those who might be tuning into this. We're seeing a change in how we view technology, period. Technology is not certainly not there any longer for technology's sake. We're really seeing it not only as a way to improve the quality of care along the points that you made, Felicia, but also embracing technology as a way to provide support for our caregivers in ways that allow them to maximize the time they're spending doing meaningful work. So we had a chance last year to meet with some of the leading EHR vendors, and it's very clear that we have their attention now on focusing some of their energy into creating ways to minimize documentation time, to implement methods for ambient notes, examples like that. And that, we're seeing virtual nursing, or as some prefer to call nursing virtually, and the expanded use of telemedicine, particularly into behavioral health. So those would just be some of the examples that come to mind.
Felicia, from your perspective, I'd love to hear how you're seeing some of the changes in how we're taking care of our teams.
I so agree. Technology is become even more important today and become more embraced, if you will, in healthcare in so many ways. I think that's a place for innovation to really thrive. We are seeing, and in the report, the 2024 Healthcare Workforce Scan noted this, the prevalence of using it in staffing models, projective analysis around, acuity, and being able to align the staff, the workforce to the acuity of the patients, really looking at those resource hours so they can be more lean focused, if you will, but also effective. And the patient experience is there. We're all about providing high quality care and ensuring that we have the highest quality patient experience. Certainly that does positively impact outcomes. So ensuring our workforce is aligned and ready is a key component. Understanding the virtual nursing, thinking about expanded uses around virtual preceptors, potentially with your more seasoned nurses on those night shifts where you may have less experienced nurses, is another thought. We have several organizations mentioned in the workforce scan around some of the innovation that they're able to do and have done with great outcomes. All the way from your smaller facilities to your larger health systems who have more resources and an expanded applicant pool, if you will. So a lot going on out there in the world around recruitment and in innovation.
Really appreciate that. Let me dig in on that a little bit. And Ron, you said this in your opening that healthcare employment has rebounded to pre-pandemic levels, although I think that we might have, pointed out that pre-pandemic we weren't doing great. We were already seeing some shortages. So continuing to look for ways to bring more people in or how to do things in different ways. But I want you to talk a little bit about some of the work you've done and what you're seeing others do to not only think about, okay, we're going to put up a job opening and see who comes, but really working with your community to grow and recruit and really retain your team and build that pipeline for the long term.
Again, I'll refer back to the workforce scan as a great document for this section as well, with a lot of really good ideas in there. Just here locally in our situation, in looking for some of the maybe what might be non-traditional sources of employees who may become future licensed caregivers. One example would be kind of marrying our work with getting at health inequities and outreach into our community, and the use of community health workers in that regard, and now equipping them with the resources, the understanding of how they can grow their careers into the future. So it taps into a part of our community that we may not have tapped into effectively before, and gives them the tools to grow their career in a different way. The recent announcement of these Bloomberg grants was very interesting in terms of supporting health systems partnering with high schools for high school career academies. And we've had a health careers academy at one of the local high schools here for about 20 years. But I think that it's an amazing opportunity to inform, and really you need to start before high school, but to inform seventh and eighth graders about health careers, and then reinforce that for those who want to enter into a health careers academy. Ours has been primarily nursing focused here, but we're thinking very differently now about educating them on and helping them fast track into other postgraduate work that will result in them being clinical app scientists, or on a different level, maybe an EMT route as well. We're seeing also with our local colleges and universities, we're fortunate to have quite a few of them here on the central coast of California. We're partnering with them to expand enrollment in the programs they already have, and also working with them to expand the program offerings that they have. We're working with an organization now to expand their PA program, for example, which is not something we had thought of before. So we're seeing growth in the enrollment and growth in the number of programs. And for us, that's serving as a very important pipeline for their graduates into our system.
I love that you have so many different ways into the community and different connections. Felicia, you mentioned specifically the idea of looking for ways to take some of those more experienced nurses to help support the newer nurses who may be struggling to find their footing. Can you talk a little bit about what you're seeing in terms of building that pipeline really as robustly as possible?
During the pandemic, we lost over 100, I believe it was 100,000 registered nurses. And we saw some of the emergence of bringing seasoned nurses back into the workforce as virtual preceptors. Many of them had burned out during the pandemic, and being able to bring them out in a new and different way was almost refreshing to them. They could still be part of, without feeling guilty of kind of missing out, if you will, on patient care, but be part of something bigger, if you will, and really really supporting those new nurses who also had some gaps in their programs. Many of them graduated early. Many of them did not have their clinical experience that they would typically get in their senior practicum, if you will. And so those were opportunities for the preceptors to really partner with newer nurses while supporting them on those shifts, the night shifts where there are less resources. I think too, bringing them back in the telehealth mode as well. We have a lot of nurses. There's more seasoned, experienced nurses can come back in that way as well as they're entering back into the workforce. I want to touch a little bit too on the interprofessional components because that's critically important as we think about team steps, as we think about interprofessional communication, interprofessional teamwork as it relates to the patient care experience. That's something we're seeing, and really there's a need to be fostered through a program like Team Steps that can be very helpful to kind of bring teams together as we think about focusing on high quality care.
We not only look for opportunities to educate these teams together, but help them function as an expert team. Speaking of the expert team, our goal really has always been to not only build a healthcare system where we can take care of our communities, but to ensure, and more than ever now, that our team that comes through our doors every day, whether virtually or physically, is well, that they are engaged, that they are safe, that they feel like they are doing, as Ron, you said, meaningful work. And I know this is a major priority for nearly everyone I speak to. And I know there is work going on, but I'd love to hear from your perspective, sort of what some of the opportunities are. They range from technology to things as simple as Ron, I'm going to call you out here, writing amazingly sweet notes to your team to thank them for things. That personal touch makes a huge difference to the team that you're working with. So, Ron, you want to share a little bit about what you're doing and what you're seeing in the field?
This is so critically important to our success going forward. We can find all the best technology that these companies are able to produce, and they're wonderful ideas. You said at the top of the hour here, Elisa, we have a math problem, and that means that we're going to have to do significant care redesign. So we're not going to be successful at redesigning care if it isn't our frontline staff who are actually redesigning care. And so that means really creating a culture where staff are motivated to be engaged, enjoy being engaged, and share the rewards of being engaged in an organization that is helping to solve their problems, and most importantly, helping them take care of their patients. So in our organization, we many years ago made a serious commitment to shared governance. It's a fundamental part of our culture, and it started with conversations in nursing. But to nursing's credit, they very quickly pointed out that it was going to be so much more successful if it engaged the entire organization. So we have a shared governance coordinating council. It has representation from throughout the organization, and there's very little that goes on here that frontline staff haven't either asked for, recommended, or made better. Ideas that we might have in my office are always made better by engaging the staff. So it's very complex. We have a broad age range. We have different demographics in terms of race and ethnicity. We have people who have no children, to small children, to parents who need their help at the kind of other end of life. And so I think some of the approaches would be implementing employee resource groups and listening to staff. So just creating mechanisms where you actually listen to what their needs are and what their ideas are, and you wind up creating a culture of innovation that really makes this journey toward care redesign much faster, and helps with also enormously with retention. People want to be a part of an organization where they can make a meaningful difference. You learn a lot, and it's very important that when you hear these ideas, acting on them quickly speaks volumes to the staff. So whether it's housing or childcare, or it might be various elements of the compensation structure for premium pay for things that that they think important that you might not have thought are important to addressing issues. Again, important to listen to them and important to act very quickly. And that word gets spread out through the organization very quickly and makes people more inclined to give their ideas the next time.
I think letting people know you heard them makes a huge difference. Felicia, your experience.
Oh, I love exactly what Ron just said because building the foundational trust is so critical to any kind of change, leading any kind of innovation. You build that trust by listening and by acting. There may be some things that will take a little bit longer to act upon, but by sharing those quick wins and really getting them meeting some immediate needs with urgency is absolutely key to really building trust and really sharing some transparency in that. So that is fantastic. It also can help some of the initiatives that you're bringing in around physical safety is so important to a healthcare workforce. Creating that cycle, not only physical safety, but psychological safety. And in this day and age when there's already increased burnout, there are statistics in this report that talk about the levels of burnout, the levels of concern, the increased incivility and bullying. It's becoming even more so, much more than it was when I was starting out in my career more than 30 years ago. I think it's taken a toll on the workforce and helping them to feel not only physically safe, but providing that psychological safety within a health system can be certainly important through trust and transparency.
Yeah, that's so true. I'm just thinking of some of the ideas around addressing workplace violence that have come into fruition here that have come directly from frontline staff. I mentioned the weapons detection system that we now have that, as it turns out, discovered there were a lot more weapons coming into the organization than we realized. So that was a great add and recommendation by staff. We also have a canine program for security and have for many, many years. And in all these years of having a canine program that has been very effective in just bringing what could be a very volatile situation, making it quiet very quickly. Our security officers have only issued the command twice in 20 years with that program. Again, an idea from staff that has been very effective here. And then just reminding our patients and visitors that our staff are real people. One of the great ideas that emerged was we have some posters and banners throughout the hospital now that show, with their permission, a staff member. It might be, let's say, a staff nurse in the emergency department in scrubs, and right next to that picture is a picture of her as a soccer mom, and it says, I'm a UC Santa Barbara graduate, soccer mom. I'm also your nurse today. And so it just sort of, helps make people real in front of their patients and family members. And it was important to staff to tell that story.
I love that example and such one that's from the staff and back to our very early discussion, one that doesn't require a huge financial commitment from the organization, but does help us get back to humans caring for humans. Ron and Felicia, thank you again so much for joining me today. You covered and touched on just a few of the topics and a couple of the statistics that are available in the AHA Healthcare Workforce Scan, which is based on a review of many reports and studies and data sources from across the country. And it provides valuable insights and practical recommendations to help organizations think innovatively and act boldly to support, retain, and recruit their staff. I encourage folks, if they want to learn more about the AHA Workforce Scan, you can find it online at www.aha.org/AHA-workforce-scan. And I want to point out that the Workforce Scan is made possible by and sponsored by Relias. To learn more about Relias, please visit www.relias.com. Thanks so much for joining us.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.